All right. Well, good evening, everyone. First and foremost, I'd like to say thank you. Thank you, everybody, for coming out tonight. Thank you to the Trilon Theater and for Designer Shit allowing us to premiere the movie here this evening. My name is Pete Westerhouse. I'm the founder of Achieving Cures Together. And, watching that film tonight, there were three emotions that hit me. The first was frustration. The second, desperation. And the third, hope. So I want to go into a little bit more detail on that. Full disclosure, I had an opportunity to watch the movie before tonight, and I made it through about 5 to 10 minutes. As a patient with ulcerative colitis, the emotions hit so hard home, I couldn't keep watching it. I had to shut it off. And it ties back to my story and how Achieving Cures Together was started. That opening scene where she's in the doctor's office and you have the doctor saying, look, there's nothing else we can do. You take your drugs, expensive meds. You're going to have to just live this way. And that was me back in 2012. I was diagnosed with ulcerative colitis at the time. I was a college student at the University of Minnesota, living my dreams of playing college football when I started having symptoms with blood in my stool and was diagnosed with ulcerative colitis. My illness accelerated really, really quickly and was having 30 bowel movements a day. Went from 235 pounds playing outside linebacker down to 148 pounds, not able to eat, not able to sleep. Life was living hell. And she depicted that in some of those opening scenes where she's sitting at the stoplight, twiddling her arm, that anxiety. Am I going to make it to the bathroom, or am I going to go to the bathroom right here in my car? It's debilitating, and your life kind of closes. That's when I was, so I was going through that is when I was introduced to the idea of fecal transplants. And I had tried every drug under the sun. I had tried acupuncture, diet changes, even yoga. A big guy like me doing yoga, that's a funny sight. And nothing was working. I was introduced to this idea of fecal transplants, and something about it just made sense. And so I was connected with our very own Dr. Alexander Kortz. And Dr. Kortz was the first doctor that sat and really listened to me. And I was fortunate enough to be part of an ulcerative colitis trial as a single patient and get 3 fecal transplants over just over a year time span. At the time, I had them via colonoscopy as well. The healing that happened to my large intestine was significant, folks. You saw those scans, what happened for Saffron in her large intestine. That was exactly what happened for me as well. However, my very end of my colon, the descending colon, was still very inflamed. I ended up having surgery to remove my colon. At the time, here I'm 22-year-old. I'm living with an ostomy bag for 9 months. And yet, it was going through that experience that I questioned a lot of things. I questioned, why am I having to take all these expensive drugs? Do doctors really want us to get better? And yet I saw the potential of FMT and was very, very excited about what this might do to the world of science and to other people with suffering from ulcerative colitis. So that was the foundation of starting Achieving Cures Together, with the hope of, let's accelerate this research and find cures. And so watching that movie through, again, a lot of emotions come up. I think there's a lot to digest and to talk about. So we're going to introduce brief introductions. Everyone's going to introduce themselves on the panel here. I'm going to be the moderator. I'll do my very best. And we're going to hit on the bullet points that are up on top of the screen, but also want to open it up for questions as well. So when we go through each of the topics, once we're through those, we'll open up for questions. and look forward to really kind of diving in. So with that, I'm going to pass the mic along to do brief introductions for everyone.
I am Amanda Cabage, and I always have quite a few hats that I wear whenever I do one of these kind of events. So I am the research program manager for the Microbiota Therapeutics research program at the University of Minnesota, and I've been doing that for almost 10 years now. I'm also an ulcerative colitis patient, and I also had recurrent C. diff, and I've had multiple microbiota transplants. So again, kind of lots of hats that I wear. And just kind of a brief note on emotions that were sparked for me with Saffron's story. My ulcerative colitis is very mild and very manageable. And so that idea when she's talking to her doctor, when she's not sick enough, she's not severe enough, it's not life debilitating, really resonates with me because my disease fortunately doesn't act up very often, but when it does, it's incredibly debilitating, and I hate steroids, and I hate every medication that I have to go on when it does act up. So even in mild UC patients, there's a little bit of that kind of minimalizing of your disease because you're not as sick as these other patients. And even personally, I sometimes feel almost guilty that I can call myself an ulcerative colitis patient and put myself in the same group as patients that I see that like are completely debilitated, in pain in the hospital all the time because my case is quite different. So it's a little bit of my background.
I'm Alexander Koretz. You saw me in a somewhat younger version in this movie. I am a university faculty, and I've been in this field since 2008. Kind of a transitioning over a couple of years toward 2008. So I started, I'm a gastroenterologist, so that's what I do clinically, but I'm also trained in an area of science, immunology. And that's how I started my scientific career. And then somewhere in the early 2000s, with emergence of new technologies of how to look at microbial communities and how to study them and what their potential was, I realized that somewhere in my mid-career point, a new organ was discovered, and I had to choose whether I'm going to follow the old track in immunology or make this change. It took me a couple of years, and I was just reading papers, and ultimately the decision was made because of a patient who came and her gut microbes were destroyed. She had recurrent C. difficile infections. We can talk about that, patient zero. Condensing that story, that really was the switch. We were the first to demonstrate that you can transfer microbes from one person to another, and that microbial community engrafts and stays there. And that's actually when we came up with the name of fecal microbiota transplant. From the very beginning, I didn't like the fecal word. So we were kind of a group of physicians talking about how to name this treatment. And I was saying intestinal microbiota transplant or something. Anyway, they insisted on the fecal word. And what happened is the microbiota, which is actually what's being transplanted, is the microbial community that got cut out, and it's become fecal transplant, which people permutate in different ways, poop transplant, stool transplant, and it's all nonsense. You cannot transplant feces. That's a very complex substance. But anyway, and since that time, we've been really working toward making it into a standardized therapeutic. So we did a number of advances toward that, and actually what we have now is the most common formulation that we use. It is just an encapsulated form of separated microbes in a capsule that look like any kind of a probiotic formulation that people can take daily so they don't have to do these enemas. And our program, with the help of Achieving Cures Together, at this point, is the only academic program in the country that manufactures these kinds of products in accordance to pharmaceutical standards. But we're not a commercial enterprise, and so what we try to do is support early phase academic trials into all kinds of different indications. And we maintain our focus on C. difficile patients as well, because those we can cure.
Beth Adams. I'm a family doctor. I trained at the University of Minnesota. And I'm the mom of a son with ulcerative colitis. He was diagnosed in 2019, so about 5 years ago, and had a lot of ups and downs, mainly downs, especially through COVID and the restrictions with that. But this past year, he won the lottery in my view when he was able to enroll in the ulcerative colitis trial using the microbiota therapy at the U, and he got better.
Wonderful. Well, thank you.